Is monogenic diabetes different from type 1 diabetes? Imagine two people with high blood sugar levels. One has a condition caused by a single gene change, while the other's immune system is attacking their pancreas. Are these the same? Not quite. Let's explore how they differ. Monogenic diabetes is caused by a mutation in just one gene. This mutation affects how the body makes or uses insulin. It's rare, making up about 1 to 5% of all diabetes cases. It often runs in families because it's inherited. The two main types are maturity onset diabetes of the young and neonatal diabetes. Maturity onset diabetes of the young appears in people under 25 and results from gene changes that impair insulin secretion. The pancreas still makes some insulin, but not enough. Neonatal diabetes shows up in infants, usually within the first 6 months. Now, type 1 diabetes is very different. It's an autoimmune disease, meaning the immune system mistakenly attacks the insulin-producing cells in the pancreas. This leads to little or no insulin being made. People with type 1 usually need insulin therapy for life. It often starts in childhood or early adulthood but can happen at any age. The causes of type 1 involve many genes and environmental factors, not just one gene mutation. That's a big difference. When you compare causes, monogenic diabetes results from a single gene change, while type 1 is caused by the immune system attacking the pancreas. Regarding insulin, people with monogenic diabetes usually still produce some insulin, especially early on. Those with type 1 produce very little or none. This difference affects treatment options. Monogenic diabetes can sometimes be managed with diet, exercise, or oral medications like sulfonylureas. But type 1 always needs insulin injections. Inheritance patterns also vary. Monogenic diabetes often follows an autosomal dominant pattern, meaning if one parent has the gene, there's a high chance the child will too. Type 1 has a more complex genetic risk and isn't inherited in a simple way. Diagnosing these conditions can be tricky because symptoms like high blood sugar are similar. Genetic testing is key to telling them apart. It helps doctors decide the best treatment and can prevent unnecessary insulin use in some cases. Recognizing monogenic diabetes is especially important for family members. If someone is diagnosed correctly, relatives can get tested too. This can lead to early detection and better management. So, while both types of diabetes can look alike on the surface, they are quite different underneath. Knowing these differences helps ensure the right treatment and improves health outcomes.